At Harbour, we are a one patient at a time treatment organisation, which inevitably means one family at a time. My name is Flynn. I'm the CEO and founder of Harbour. So what we're looking to do is to support not just the individual who may come in specifically for treatment, but also the broader family dynamic as well. With a one patient at a time approach, you're able to manage the privacy and discretion in a way a treatment provider in a, say, multi-bed facility simply cannot. What we're doing is we're providing the initial stage, we're creating the environment for change, and with the engagement from family and from the patient, we're creating the circumstances to really uncover what level of support is going to be needed over time. We work with addiction, we work with mental health, neurodiversity, and a range of physical health, what we call comorbidities. And the way we work with family around that, it differs. And some families, they will have already gone through this process many times and may be remarkably well informed with regards to the needs of their loved one. But in other instances, that might be their first experience. There may never have been an admission for mental health before. So what we have to make sure is we're providing specific educational support to help them cope with what is an immensely difficult time. And a lot of this is practical, but it's making sure that our team are available on hand 24 hours. And we want to make sure that any family that is working with us is armed with the skills and given a level of support from our infrastructure to help achieve the very best outcome for all. Not every patient that comes in for treatment with us is coming from a settled and coherent family background. The reality is often quite different. So what we have to do on a case-by-case basis, gain as much understanding very quickly about our approach, and to make sure that we're able to work in a compassionate and empathetic way, but also understand that sometimes the involvement of some family members can be compromising to the potential outcome. At Harbour, what we tend to find is patients don't want to be in treatment for a long time, but the initial stage of treatment is formative, and it's formative for the family and for the individual. As you move to the next stage, which is usually what we call outpatient and aftercare support, that can continue for as long as necessary. And family members feel very reassured that we're not going anywhere. We help families reset boundaries, establish trust, and I think we do this in a kind and supportive way. Because what we have to remember very often when patients come for treatment, a lot of that is broken, and there's an incredible amount of reparative work that has to be done. Each case has its different nuances, and I think we're very well prepared and supported to be able to do that. From my experience over the last number of years of working with families from all over the world, where families engage the process with Harbour, the outcomes, not just for the patient that's in treatment with us, but for the broader family dynamic is transformational. I've seen families get back together, I've seen divorces avoided, I've seen babies born, I've seen people take public office, I've seen people take companies to be listed. For me, there's nothing more gratifying than that. My message to family members or somebody who is struggling themselves is, please don't lose hope. There are organisations like ourselves out there who want to help, and it's not your fault. And pick up the phone, drop me an email, and let's have a chat about it, and let's understand what's going on. And you can do that safely, your privacy won't be compromised, and if we can't help you, I can assure you that I'll be able to signpost you to somebody who will. But you'll get kind, compassionate support at any time you contact us.